I'd like to call the Health and Human Services and the Social Services Committee meeting to order, please. Good morning. Hope you all had a nice Easter and ready to start off another week. Janelle, as soon as we approve the minutes, we'll be ready. So I need a motion to approve the minutes of last month's meeting. Supervisor Loeb, seconded by Supervisor Driscoll. Any additions or corrections to the minutes? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Janelle, it's all yours.
Good morning. First, I'd like to start by welcoming Pat Belden. She is our new Assistant Director of Public Health, but she's no stranger to public health because she's been with our agency for 29 years.
Right. Well,
She got
congratulations.
the memo, so.
Coming out of the closet.
So, starting right along, the first resolution request is to authorize myself to sign a memorandum of agreement with Hudson Headwaters Network for a hepatitis C program with an automatic renewal unless there's a termination request within 30 days of written notice by either party. The reason for this is we have an SPD clinic where we offer HIV testing services. This will be hepatitis C testing. It's available and there is no cost, with the exception of offering location.
Right, very good. Supervisor McGowan, you're making the motion to approve that. Second by Supervisor Lowe. Any questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
All right, the next four is basically the same resolution request, just with different agencies. But the first one is to authorize a contract with Access Therapy Group to provide Committee on Preschool Education Services for Warren County children who are eligible. You know, with the shortage of service providers, this is going to increase our accessibility. We do get reimbursement at a 56.5% rate. But it's a service we have to provide. It just allows more opportunity to be able to service the children.
All right, someone like to make that motion? Supervisor McGowan, second by Supervisor Lowe. Any questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
All right, the next one is to authorize a contract with Building Blocks Learning Center to provide CPSE services for Warren County who are eligible. Again, the same rationale.
All right, someone like to make the motion? Supervisor McDevitt, seconded by Supervisor McGowan. Any questions? All right. Supervisor Leggett.
Thanks. So on all these, are rates different, rates all the same?
No, you know what, they're all the same, but Ton was just correcting me. It's actually 59%, not 59.5%. 59.5%.
That's even better. I second the amended motion.
Yes.
Thank you, Mr. Chairman. Are these the same reimbursement percentages as in the past, or has that gone down?
Same.
Same. Okay, so that 59% is the same we've had.
For many, many, many years.
All right, any other questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
Just a quick question, do I need to go back up and ask for the access therapy at the different rate, or am I still okay with that one?
No, she said you're okay with that.
Okay. The third one is to authorize a contract with Saratoga Speech Pathology to provide CPSE services. And again, this contract is going to increase the availability, and it is at the 59.5% rate.
All right, someone like to make that motion? Supervisor Lowe, seconded by Supervisor McGowan. Questions?
CPSE, what's it stand for?
It's the Committee on Preschool Special Education.
Thank you. Oh, so it's just
All right, any other questions? All right, all those in favor?
Aye.
Aye. Opposed? Carried.
And the final preschool request is to authorize a contract with Bogstead Therese for Freedom Torch Consulting to provide Committee on Preschool Special Education Services. And again, this is a 59.5% rate reimbursement.
All right, someone like to make that motion? Supervisor Driscoll, seconded by Supervisor McGowan. Any questions? Supervisor Driscoll.
These all four of these contracts are the same contract year?
Well, same contract, we're requesting automatic renewal unless there's termination by either party with 30 days written notice.
Okay.
But they're all to provide basically the same services, but for different new options for us to then further have availability for our children.
But the contractual periods are the same? one doesn't start?
Well, we're all hoping that they're going to start after your board meeting.
Okay, all right, okay.
And then go forever is what our
All right,
hope
good.
is. But-
All right, thank you. Supervisor Beatty?
Chairman, Chairwoman, are there any new contracts here, or these are all past contracts?
No, these are all new.
These are all new
These are new.
contracts?
They're new providers.
as all
New providers, but I guess, I should have phrased this better. Are there any new programs in here? These are all just new providers, which, okay.
Right, and just to clarify, for those of you that might not be familiar with our preschool program, also called Committee on Preschool Special Education, or CPSC, a lot of different names. These are for children for age 3 to 5. We work with the school districts. They're actually the chair of the CPSC committee. We provide a municipality rep to go there to provide representation. A lot of these are children that we've worked with our early intervention program from 3 to 5. But the services that we're talking about, hopefully we're talking about like speech or PT or OT type therapy within the home. We do have the opportunity for groups, but then also the preschool program for children that have many needs, where they might actually participate in a whole program, where we would also be providing transportation. So these are the services that we're talking about, but this is to allow more people for us to work with so that we have more places to put our children.
This is a set population. In order to get the services, you need to qualify for the services, and they're mandated services, both with state mandate. So, again, as Janelle said, it'll just be more venues for the services to be provided, if you will.
True.
All right, any other questions? All right, all those in favor?
Aye.
Opposed? Carried.
All right, the next three are basically for job-related education requests. The next one is to authorize Jignasia Shah, our Public Health Program Coordinator, to receive reimbursement according to the CSCA union contract for a job-related course for Anatomy and Physiology 2. And related course expenses. This course provides a comprehensive study on structures and functions of the human body and provide a stronger basis for outreach and teaching public health concepts in her current position.
All right, someone like to make that motion? Supervisor Loeb, seconded by Supervisor McGowan. Any discussion? All those in favor? Aye. Opposed? Carried. Thank you.
The next one is to authorize Jignasia Shah, Public Health Program Coordinator, to receive reimbursement according to the CSCA union contract for a job-related course. This is an Epidemiology 503 Principles of Public Health and related course expenses upon successful completion of the course and attaining a C or better. This course prepares students for continually changing challenges in public health. Jignasia is starting her Certificate of Public Health program, and this is the first of 6 required courses. The State Health Department encourages public health staff to receive education on essential public health services and core competencies, so this program will meet that.
All right, Supervisor McGowan makes the motion, a second by Supervisor Driscoll. Any questions?
Just
Supervisor
one
Loeb.
comment, Madam Chair, that reading these resolutions and the rationale takes me back many decades, so I feel good for them being able to take the courses.
Well, that's true. I agree with you on that, too. All right, so we've had the motion, second, right. All right, all those in favor? Aye. Opposed? Carried. Thank you.
And my final resolution request is to authorize Laura Monroe, a registered professional nurse, to receive reimbursement according to the CSCA union contract for a job-related course. She's taking a course that's ethical and legal considerations, and we're looking for also related course expenses upon her successful completion of attaining a C or better. Laura's working on her bachelor's degree. She's so close. And this is a course requirement. There is an added benefit for this course to provide a sound basis with our agency's corporate compliance program and also the scope of nursing practice and home care regulations.
All right, someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Driscoll. Any discussion? All those in favor? Aye. Opposed? Carried. Thank you.
All right, at this time, there's no pending items. Information for discussion and review. I will turn on to our attachment 1 and 2 for our expenditures, revenues, and also for the comparison report of 2018 to 2019.
Okay, attachment 1 are our current financials as of April 10th. We have accrued, I've been coming up the last couple months saying that we're always off in expenses because we haven't received our expenses yet for rents. I did get those numbers, so I have put them in there. They weren't paid yet when this report was done, so I better give you an analysis. Rent for WIC was $22,515, and health services, which is everything else, is $92,766. So those are in our numbers now, so you can better get an idea of where they are. Revenues and expenses, we got our WIC in for the food voucher value, which, like I said, for year-end information, that is in the 2018 prior numbers too, so that you can get an idea where most of our numbers are now almost finalized for 2018. Regarding salaries, again, we are under by 8.02% overall from last year. We are 21.18% of the current budget this year, and last year at this time we were 26.98%. So again, we're down. Really where we're down in is our regular salaries, and we're almost even with part-time, overtime salaries. Again, we're over compared to last year at this time, but again, most of it is related to, we have our weekend stuff, but also the Crescendo, our new program. Again, documentation of that. The system is a little bit more difficult to try to get this. We're working on a team to get things going on that and try to analyze that, but that's where the overtime, we're hoping that'll start to settle down as we go on. Our attachment number 2, which is the comparison of last year to this year at the same time. Again, the salaries, like I said, we're under $60,000. Contractual expenses, as I said, we've got rent in there now, but primarily it's our preschool program, which we've been talking about. Just under, it's about $77,000 less than 2018, so I think it's just a matter of catching up, but that's 97% of the difference is really the preschool program, just getting those numbers in. Our employee benefits, again, are down by $31,000. I did note that the March retiree health had not been posted when I printed this, so that's pretty much a lot of the difference is just regarding some things that just haven't been posted in timing. Revenues are slightly down a little bit. We're in the middle of almost closing for the month of March for our home care and our clinics. We continue to show the revenues for those, so overall, not too bad compared to last year.
Okay, very good. Thank you. Questions? Supervisor Sokol.
Excuse me, for as long as I've been chair of health, and I'm sure you know and recognize it as well, I am just incredibly impressed every year how you guys continually save on salaries. You continually do more with less, and it's pretty impressive. I'm very happy and thankful.
I would agree with Matt on that 100%. I think they do a super job.
Great. Next is our status of referrals, which is attachment 3. We'll have Val provide that information. And just to note, this is actually the second month that we have reported on February. We're going to start reporting 2 months back, just so our number's more consistent. For those of you that were at the last meeting, you might have known that our percentage was negative 47 when we reported our numbers at the last committee meeting, but it is taking a full month to kind of get a more accurate number, so we're going to kind of start reporting 2 months back. So reporting an updated number for February and taking it off.
So as you can see, it's negative 21, which is much better than what we had thought. And sometimes the reason for that is because we are down with some staff, we have 2 nurses that work per diem, and they're the ones that do our orders and stuff like that. So they in themselves cannot get the full process done. Sometimes they may do 2 days a week, sometimes they may do 3. So we have taken one of our full-time nurses and also stuck her in that part with helping to do the orders, so the process can move a little bit quicker. Again, that number, minus 21, when we look at what's going on, and I know that last month when we were here, I did talk about Glens Falls Hospital, and I think I was mistakenly taken to state that, or it was understood that because of the issues that's going on at Glens Falls Hospital is the sole reason for this, and that is definitely not the case. Hospitals, the same as home care, we have certain regulations that we have to follow. Insurances don't want to pay for patients to be in the hospital, so when they go into the hospital, a lot of times they're just observation, where years past, when they went in, they were admitted, so when they came home, it looked like we got a whole new patient. In today's world, the insurance doesn't want to pay, so the patient goes into the hospital under an observation status. The hospital gets a different reimbursement rate for that. So when those patients come home, they're like our regular patient. You know, the process of what we do with those is much less. You know, the time it takes to get that patient put back on board. When they're in observation, they were never taken off. Whereas in the past, when they were admitted, then, you know, that whole process of admitting a patient can take anywhere from 3 to 5 hours. So it's all looked at differently. And more patients are going to rehab centers. You know, we get referrals early on from the hospital, and then by the time they're actually ready to go home, because insurance wants to, you know, you have to be pretty sick to be admitted. And so we do get referrals that never come to fruition because of either rehab or perhaps the patient's passed away because they're so acutely ill.
Right.
And I by no means want it, what I said last month, to be a reflection as to whatever's going on in Glens Falls, because it's all hospitals. You know, everybody in the healthcare, we now have different constraints as to what we can do and what we can't.
Right, thank you for that clarification.
Thanks, Val. So one of, some of these patients or referrals may have already been
Correct.
our patients
Right.
and being taken care of.
Or historically, they would have counted as a new referral.
Oh,
and
okay.
It's all in the statistics and how they're being counted.
Good, thank you.
You know, and the other side of it is we have so many more home care agencies out there than we ever had. So, you know, we're never going to have those same exact numbers. We pride ourselves in that we just, you know, kind of take every patient, you know, no matter what, you know, if this person's going to cost us money or, you know, or we're going to lose, you know, we kind of believe in as long as the patient's willing to put effort into following their plan of care and they want to get better, we give that patient the opportunity, where some of the home care agencies, from what I've been told, I've not worked anywhere else, but those aren't, you know, the same statistics. And we do what we do best.
Supervisor Loeb?
Thank you, Madam Chair. On that point about the other agencies,
Right.
I wanted to some historical background and bring us up to date. 6 years ago, 7 years ago, there were agencies that were trying to come in and set up shop here, and we were concerned that they were going to cherry pick. Get the easy ones. They would be able to go next door, go to the apartment building and get all the money from the apartment building, and we'd have to go travel a long ways. That has occurred as far as they have come on board. They're in the area. I'm wondering how that has affected our service level, the amount of staff, our expenses, our revenues. It did look like it was going to be a good thing in the beginning, and how bad is it?
I guess I don't really understand.
But we go out for home visits.
Yeah.
And we go to Glens Falls and go right down Sherman Avenue, boom, 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 boom. Or you can go to Weavertown,
Yeah.
Thurman.
Well, some of the other agencies,
The
they have
agencies
satellite
They were going to
offices.
take Sherman Avenue, and then we were going to be relegated Thurman and Creek.
I would say no.
Has it had a negative impact on us in the end?
Yeah.
Well, I think that's the biggest reason that we've been tracking our referrals.
Yeah.
So like if you go back to February of 2018, it shows, you know, the 88 compared to the 89, and then as far as the skilled nursing evaluations, you're looking at 99 compared to the 91. Even though negative 21 seems horrible, it's not really that many patients that we're talking. I think similar to what we're seeing in like our preschool program, there's a lot of need, and the other agencies are helping to address that need, but I think we're the ones that are still getting in there within the 24 hours. I think our providers are kind of recognizing that, so they are sending business our way. Is there cherry picking going on? We're kind of hearing stories that there are, but again, we're not in a position to really point fingers. I think it's a little disappointing from the state health department standpoint that there's not some type of mechanism in there, some type of report that they have to review on what's your percentage of Medicaid patients, what's your percentage of private pay, what are your percentage of zip code patients, and somehow be able to compare agencies. But I think all in all, we have a strong agency and we're holding our ground very well. And just even with the tracking of referrals, the looking at our revenues, things like that, I think we're holding pretty consistent despite the competition. And I don't think any of the competition is really knocking at our door and in a position to really kind of outseed us, if that's kind of...
Good news. That's great. Thank you.
And I do, if I can add, that our staff is incredibly dedicated, hardworking. You know, when we've been up and down with staffing, they've been out there seeing patients at whatever cost. And despite with a new system that where they type in an order, it gets lost and they have to retype it 2 or 3 times. That's kind of where your overtime's coming from, is the frustration of that lost work kind of scenario in addition to a busy caseload. But we did just hire 2 nurses this month, so we're good.
Good. And again, the nurses that we have to replace when we do, for the most part, is because of retiring. It's not, oh, I don't like it here, you know, that type of thing. And a lot of our per diem staff are ones that have been here, retired, you know, and choose to stay on. And we do have a couple of nurses that have been here, left, went to the competitors, and have come back. So that means a lot for us.
Thank you.
Okay, thank you.
Okay, so attachment 4 is our emergency preparedness report that Dan Durkee prepares each month for our agenda. And just worth noting, on the 11th we had a drill where we tested the ability to receive supplies and then divvy them up. And I just want to thank the other departments that helped us, specifically DPW, Buildings and Grounds. We borrowed their property, and we borrowed their staff to kind of help us move things around a bit, and other people, but we're appreciative of the help that our departments provide each other. And then we have the Rabies program report. This kind of, it's a quarterly report from January to March with our statistics, nothing too exciting there. Anybody has any questions? Otherwise, I'm done.
You have nothing else?
Well,
You just gave us the information about you attending.
oh, I'm sorry. I do have some other stuff. I
Okay.
had an extra page I didn't see. For informational items, we have 3 conferences. This is a busy time of year for conferences and the annual conferences specifically. Through NYSHO, I've been provided the opportunity to go to the New York State Public Health Association Conference, Envisioning Healthy People in Healthy Places, and that's going to be taking place in Cortland from May 1st to 3rd. NYSHO, like you said, is picking up the expenses for the lodging, the conference, and pretty much everything except the travel out there. Val Wisnot, our Assistant Director of Home Care, is going to be attending the association's annual conference, Force for the Future conference in Saratoga Springs. She's going to be driving back and forth May 8th through 10th, and we have money in the budget for that. And then we have 2 WIC staff that are going to attend the New York State WIC Association Conference May 20 to 22nd in Syracuse, and that's fully paid by the WIC grant. I mentioned that we hired 2 new nurses this month that are currently doing orientation. Fortunately, I'm not asking for intent to fill positions this month, and now I'm done.
Okay, very good. Thank you. Does any committee member have questions? Supervisor
Just
Lincoln.
a quick question, Janelle, relative to measles in the state of New York. All of a sudden we see a rebirth of a disease that one would have thought had been totally eradicated and gone, okay? But here we have the borough of Brooklyn, a religious community that, at least seems to have accepted the pablum that vaccinations don't make sense. So
We're very fortunate in our area to have a high vaccination rate. We work very closely with our schools and our daycares, and we actually monitor those rates through a program through the State Health Department. We feel pretty good about our rates. We do have provisions in place. We provide education to our providers with regard to that. Unfortunately, that is down south, but people do travel, especially this week. It'll be interesting to see. We have had, I think, and I'll turn the floor over to our Pat Belden, our new Assistant Director of Public Health, but I will say that we've had a couple of cases already that we've had to rule out that fortunately have been not measles. So, Pat, do you have anything else you'd like?
I do. The majority is, like you said, downstate. New York City, 329 cases since October, and Rockland County had 190. So there's been over 500 cases since October of last year. And they have, Rockland County is the one that put the travel restriction. They're trying to, make it a little bit more stringent on anti-vaccinators or people who are not vaccinated for whatever reason. But we haven't, like Janelle said, we have a really good immunization rate in this area.
One of the good things the State Health Department does is they send out alerts. And when we get those alerts, we forward them to our partners, like the schools, the medical providers, the hospitals, to say, if people show up with this, this, and this, we need to follow this protocol. We need to, take these precautions to ensure that we're not putting medical staff at risk. Now's a good time in a readiness position, is all your staff vaccinated? If not, trying to address that before we get that suspicious case. So we really do have a close, tight working relationship with our providers.
And I guess I would maybe leave one comment. The quandary of you might say, human beings, you have religious leaders saying, don't vaccinate your children, and then you have scientists saying, come on, this is insanity, okay? So, pretty close to us, Rockland County, Brooklyn, 3-4 hours away in an automobile. So.
And I will say, being maybe a little forward, the legal experience of Rockland County is going to benefit our county attorney's office and our office in learning the difference between a health order and executive order, things like that, and what some of those powers are and the length of the order. So should we be in a situation where we're coming up here asking for orders, we've got some lessons learned from some bigger counties on kind of what to do and maybe how to more creatively address what the needs in the community might be at the time. So.
Thank you.
Anyone from the audience have a question? Supervisor Thomas.
Measles virus more intense than it used to be, or is it the same virus?
It's the same virus, but it's just highly infectious. It's always been. And actually, with the vaccination requirements, typically our children are getting their first dose at a year and their second dose when they go into kindergarten. Adults that aren't vaccinated can get their first dose and their second dose within 28 days. Later if you're on an expedited scenario. The biggest reason for the second dose is to try to get better coverage. The vaccine's about 97% effective, so for everybody that gets it the first time, 97% hopefully would be protected. But we ask, not we, but the State Health Department, the CDC, have the standard of 2 doses to try to catch that 3% because of the high infectivity of it. So
I think they can spread the disease before they even know that they have it. So before that rash appears, about 4 days before, they can actually be spreading it, and they didn't know that they had the measles. So that's
4 days before, 4 days after. And for somebody that's not been protected, meaning they haven't had natural disease or they haven't been vaccinated, it can be up to 21 days before they come down with symptoms. So that's where your isolation takes place.
All right, Supervisor Wild.
I saw something, I think it was on before and after in 1959, whatever, that you needed a second dose because they stopped doing the single dose vaccination.
Well, actually, prior to 1957, because it was so wild, so it was widespread throughout the community, it was assumed that most people have the natural immunity and didn't need the vaccinations. But I think people that even were born in the 50s or before are now, if you're in health care, they're encouraging vaccination because of the highly infectious nature of the disease and wanting to be vaccinated. So, did that answer your question, or did?
What we're going to do about it. Right?
Yeah. If they're in health care, they should be getting vaccinated.
Is that something that's been notified?
Oh, yeah. This isn't the first measles.
we had the first outbreak in '92, right?
Right.
Huge outbreak, and
And for those of you that, I wasn't in the community at the time, but for those that were here, it was during the basketball tournament, and only players could go in. Spectators couldn't, so you can only imagine some of the challenges that were associated with,
Yeah.
spectators not being able to go in and watch their children play. But, you have to do what you have to do to protect the community.
Hey, are we good on questions? All right, then, ladies, you did a great job. Thank you. Have a nice week.
Thank you.
Thank you.
Denise, we're all set? Come on up.
Thank you.
Morning, Denise.
Morning.
Remember what stuff goes on with the flu?
There.
Oh, hey, thank you.
But measles, it's a big deal. I mean, measles that's
Good morning.
a crisis situation. I mean,
Flu, much more so.
not that I've had it.
Back in back before any of us were born, everybody was all upset about cholera. Nobody died of cholera. Nobody cared about typhoid, but people were dying by the thousands and thousands. But it was so like, oh yeah, as soon as that's so dated. Needles, Ebola. We'd be really excited, but every year thousands people die of the flu. And don't get vaccinated, you're not protected from, one person in this room.
We're all set. Okay.
All right, we're here to discuss the Joseph P. Dwyer program, the peer-to-peer support group services, Veterans Connect, sometimes it's called. I have three things on my agenda today to request and amend the budget for the program. The grant money is here currently. It just needs to be transferred into the budget for that program. A notice to intent to fill a vacant position, and approve and accept the intermunicipal agreement, which is also at Washington County, and they're doing their thing simultaneous.
Okay, good. All right, let's go back to number one then. We'll start with the request to amend the county budget. What is that amount for that, Denise?
Well, the full grant was $185,000. We are only, for lack of a better word, pulling down $46,287.
Okay.
Okay?
Good.
For the year, for the remaining part of this year, and then we'll readjust, because we don't even know how long it'll take to fill the position once we can post it, so we'll readjust it come next budget.
Okay, so would someone like to make that motion to amend the county budget? Supervisor Bramer, seconded by Supervisor Sokol. Any discussion?
Do we need to amend for receiving the revenue?
I believe that was already done by Rob. You already did that, Rob, right? York?
I believe so, yes.
We have,
Funds, and as far as I know, Rob Lynch sort of parked it somewhere until they could figure out the budget code that he needs.
That's my understanding.
we've received the funds, but if the committee would like to authorize acceptance, I guess it wouldn't hurt.
Okay.
I don't think that that's a requirement of this particular grant, but it doesn't hurt.
All right, Supervisor Driscoll?
You'll
make that.
I'll amend my motion.
You'll amend the motion?
Okay, yeah.
Accept it.
Okay. All right, any more discussion? All right, all those in favor?
Aye.
Opposed? Carried. Thank you. Now, the next is the intent to fill the vacant position, right?
Yes.
Okay. Any discussion on that, Denise, or just that's where we're at?
No, the job description has already been approved by HR. I know it'll go through the process over the next coming month to make sure everything's right, all T's are crossed and I's are dotted, but everything has, with also Trish Denninger, made sure that the job description fits into the grade. And
Okay, great. Then would someone like to make that motion? Supervisor Bramer? You
Yes.
have a question, but can we get a
Just-
second to the motion then? Supervisor McDevitt, all right. Ms. Bramer?
No questions. I think this is great, and I'm really happy to see you moving forward. Thank you.
Yes, thank you. All right, Supervisor Loeb?
Yes, thank you, Madam Chair. Just to expand on what Supervisor Raymer just said, this is a great program.
Absolutely.
It gives me a lump in my throat because we deal with it personally in my family.
Right.
This is just unique to New York State. Do other states have any programs like this?
That I'm unsure about, but I have been many phone calls with other counties that have had it established back in 2012, trying to just pick what we need for right now from them. Some of them are much bigger on a much broader range of how they, first of all, the grant money that they receive, and second of all, how they roll out the program. So it is going to be still a learning process even after hiring a coordinator. But I am unsure whether or not other states might have one that's called something different. I'm sure they have something, just I'm not sure it's called peer-to-peer or under the Joseph P. Dwyer program.
Thank you.
All right. Any other questions? All right, all those in favor?
Aye.
Opposed? Carried. And the last thing, Denise?
And the last thing would be, I mean, kind of like an odd thing. We do know that this is a shared county, okay, cooperation. And I do want to point out, he obviously, we're all busy. Ken Marwinchel, the director for Washington County, has wanted to be here for the past 2 meetings, but it just hasn't worked out. But he has certainly done his part. We've met within the past 2 weeks over the program and his insights to how he wants to roll out the program, where we would like to start, you know what I mean? One thing would be transportation. We have just locally getting veterans to and from their medical appointments could be, for these homeless and at-risk veterans, it could be a huge benefit for them because they don't have transportation, let alone someplace to live that they call home. So I do want to note that he is doing, you know, his part in this. It's just that he hasn't been able to attend our meetings. So it's to my understanding that we can, you know, read this intermunicipal agreement, get it signed here by the chairman, and then pass it on to Washington County, where we'll exchange basically, because theirs will be signed. And I think that's where we're at with that.
All right, would someone like to make that motion? Supervisor Loeb, seconded by Supervisor McGowan. Questions? Supervisor Loeb?
Thank you, Madam Chair. Just for personal, is there any particular, or could you send me their job requirements for this position?
Oh, absolutely.
I like the selfish reasons for, because my son would like to get involved with it. He's out in Utah.
Okay.
That would be perfect.
Good.
Because the peer-to-peer is what keeps him going on a day-to-day basis.
Right. Does every supervisor want to see the job description, or just, yes, I can send it out to all of you.
That would be great. Thank you,
Yeah.
Denise.
Absolutely.
All right, any other questions? Yes.
Just a funding question, Denise or Rob, I'm not sure if we know the answer to this yet, but there's another $185,000 that was part of the recently passed state budget. Do we know when those funds will come into the county?
I do believe they won't be able to be received until after June of 2020, if I'm not mistaken. Or is that...
I'm not sure of the timing of that, but I know it was included in the
Right.
enacted budget, yes.
Well, regardless, we'll have a few years with the first round of money, so
Yeah.
Thank you.
I mean, this 185,000 was from June of 19, or June of 18 through June of 19. I don't expect that we would spend it all.
Right.
Within that, you know, coming up here. But I do believe we, you know, once we start getting to zeroing out that grant that we currently have on site, that we start applying for the next budget. Yeah.
Great.
Or grant money, yes.
All right, any other questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
Thank you very much.
Thank you very much. Enjoy the rest of your day. Rob?
Thank you. You want to give me a bunch? Yeah.
Down the roll.
Okay.
Here, you want to...
Yep.
Okay, we're all set.
Okay, good morning, everyone.
Morning.
All right, so I have a few items here. The first three are actually all related to the same thing. What we are doing is we've received $60,000, 100% state aid from New York State OASIS to provide or to arrange for substance abuse services in the Warren County Jail. Earlier this year, I brought forward a request to work with an agency that's called Baywood Center. It's part of 820 River Street. We were going to work with them to do these services in the jail, and it turns out that the New York State OASIS does not want to approve right now passing money to that organization because there's an ongoing lawsuit with their parent organization in the state. So the OASIS will not approve that funding, state aid, to go to that agency. So what we need to do, together with Sean Lamry from the Sheriff's Office, we met with another provider, the Addictions Care Center of Albany, and they have put forward a proposal that was acceptable to the undersheriff, and so we want to kind of switch gears here and work with the Addictions Care Center of Albany. So the first request is a request to amend transfer the funds from the budget line that we had initially gotten approval for, which was the 820 River Street contract line, and we want to transfer those funds into the Addiction Care Center budget line.
Would someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Loeb. Question, Ms. Bramer.
I just had a quick comment. I wanted to say that this ongoing litigation with the parent company does not reflect on our local organizations who are doing a great job. And I wanted to say that Senator Little also stepped in because we have a facility in Glens Falls that is under this parent organization that is being impacted by the state basically blacklisting money going to these organizations. So I just want people to know that our local organizations are doing a good job. They haven't done anything wrong, but they are being negatively impacted, which is why, thank you, Rob, and for finding an alternative way to get these services provided to people who are in jail. Thanks.
And again, I agree with that. It's not a reflection on the Baywood Center. They're an operating clinic that OASIS continues to certify, so OASIS does sanction them and does approve of them providing services in our community. They're just not allowing state aid at this point to pass through to them. Initially, we did advocate to see if they would reconsider. They wouldn't. I don't want to lose the funding, so I felt like it was time to move on to another provider at this time because OASIS was pretty adamant about not passing the funding to them.
All right. Any other questions? All right, all those in favor? Aye. Opposed? Carried.
Okay, so the second one is a miscellaneous request. This is to rescind the previous resolution, work with 820 River Street. So this is just really part of the same thing.
All right, a motion made by Supervisor Sokol, seconded by Supervisor Bramer. Any discussion? All those in favor? Aye. Opposed? Carried. Thank you.
And then the third part of this issue then is to amend our current contract with the Addictions Care Center for the $60,000, again 100% state aid from New York State OASIS for this purpose.
All right, someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Bramer. Any discussion? Supervisor Leggett.
Thank you. You know, it says additional, but the first contract is for $60,000, this is for $60,000, so it's still $60,000 contract, correct?
So the additional is just because we have an existing contract with the Addictions Care Center, currently for $511,000 for residential services, and they're in the process of developing residential services for us. So,
All those in favor?
Aye.
Opposed? Carried.
thank you. Fourth resolution request is again a miscellaneous request to amend Resolution 82 of 2019. I had previously this year brought forward a request for education, job-related expenses for Carrie Wright, our program analyst. In that request, we had only put in the tuition expense that she was incurring, and did not realize that the Warren County policy would allow for a portion of her books and fees to also be paid. That request was approved, so I would like to also include her. It actually is 50%, but 50% of her books and fees.
Someone like to make that motion? Supervisor Bramer, seconded by Supervisor Driscoll. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
Thank you. Then the last item that I have is just an informational. During the past cycle, we had 2 authorizations to attend meeting or convention forms that were signed and approved. And my understanding is we're supposed to just bring these in as informational items to the committee. We had a permission for Linda Wright, who is our Children and Youth SPOA, which is a single point of access. She coordinates referrals for children's services. She had a regional meeting that was held in Kingston, and that was at a cost of $126.44. That's based on the mileage rate. And we utilize our own vehicles for travel just because, being a shared office, we have a charge back to Washington County at the end of every year, so they pay half of our administrative expenses, so that allows Washington County to share in our travel expense. And then also we pull in state aid, so it actually allows for the state and Washington County to share in our travel expenses if we use our own vehicles and then get the reimbursement, the mileage rate. So
Okay,
that
very
was
good.
one request. And then we also had Lisa Kutu from our office. She's our Deputy Director of Clinical, and she traveled to Albany for a training on psychopharmacology related to medications related to mental health. They're always coming out with new medications or changing things, and that was at a cost of $268.19. Again, these were budgeted for in our travel line. That included her travel and a registration fee.
All right, good. Thanks, Rob. Any questions from the committee? Any questions from the audience? If not, then I guess we're good, Rob. Thank you very much.
Thank you very much.
Say, everybody's at this table and one person isn't vaccinated. It's fine. Church with money protect you of her immunity. 6 of us aren't vaccinated. You're not, you use that protection. Educated people, I get people at the hospital. Oh, I'm not going to get you. Conspiracy, anti-vax.
Passing out the agenda, the material. We also had a couple staff attend a conference last month. We had 2 of our counselors attend the annual youth conference down in Saratoga. And we also had
Put a visor on the house.
We also had 2 of our youth participants participate in a panel discussion. We also had two of our youth from our program participate in a panel discussion during one of the presentations at the conference that was very well received.
Good.
Yeah, the conference was in Saratoga, so it was easy for us to help out, and it was very beneficial. Good morning again. I have three action items for the board to consider. The first one is a resolution request for a new contract with BOCES for our summer operation food chain. This is essentially the same program we've operated for each of the last dozen or so years. The price actually is just a very slight change over the prior year. About half the request is for staff, and then the other half for materials and supplies.
All right, someone like to make that motion. Supervisor Loeb, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
The second resolution request is to sign a memorandum of understanding with New York State Department of Labor. I had exchanged emails with the county administrator a while ago. Our staff, there's two primary database systems that the Department of Labor uses. The first one is the one-stop operating system. Currently, all of our staff have access to that, and they have since it was originated. But there's another operating system called the Reemployment Operating System, or RIOS is the acronym is. And the conversation with the county administrator, he didn't see any problem in our staff using that, and then when we went to implement it, they require a memorandum of understanding, so we're back to the committee anyway, which is fine. It's a 2 or 3 page agreement that everyone signs, mostly to protect confidentiality. But the reason why we've been asked to use this program now, the state has become very strict with customers that are on unemployment. If they miss a mandated meeting, their benefits are suspended until they come in to rectify the situation. And that rectification is done through RIOS. And by not having access to that, we can't lift those holds on people's unemployment payments. Typically, it's people that had maybe a temporary job when their appointment was scheduled, or some other issue that prohibited them from being at the meeting. So that's the reason why this came up now.
All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor Bramer. Any discussion? All right, all those in favor? Aye. Opposed? Carried. Thank you.
And the next resolution request is to execute again, a memorandum of understanding for the cost allocation plan with the Saratoga Warren Washington Workforce Development Board. The board has 2 part-time staff people, and every year that budget comes before this board for review and approval. You see on page 5 the budget request for we're in program year 19 beginning July 1. It hasn't changed from the current year, and it's actually down a little bit from 2 years ago. Certainly happy to answer any questions. The marketing money in the past was used to create the new website that we have recently put up. The joblink.org is the address, and I had shared that with the committee previously.
All right, would someone like to bring that motion to the floor? Supervisor Driscoll, seconded by Supervisor Loeb. Do you have any questions for Chris? Supervisor Loeb.
Yes, thank you, Madam Chair. Chris, this segues into the last part. You, personally, do a great job.
Thanks.
And you've got your department downtown. Great job. And so the segue is, why do you need Saratoga, the whole umbrella organization? Why can't you just do it by yourself and not have to get involved with everybody else?
The easy answer is that the federal legislation does not allow that. When the Workforce Investment and Opportunity Act was passed in 2014, they put in very specific requirements for how the operations and administration of the program functions. There's a lot of accountability that's granted to the governors. The governors of each state actually designate the workforce development boards, and you're in essence required to create those boards There's actually something called an operator. So we actually, the board, the Workforce Development Board actually has to go out now and hire an independent third party to come in and organize meetings as the operator. So it's very strict and mandated, and if we didn't have that superstructure, if you will, we wouldn't be able to access the funds. One of the things that is coming up that I think the committee will find interesting, for the first time in a dozen years probably, we have a meeting set up next week with the leadership of the Workforce Development Board and the county administrator and chairman of the board, just to connect and communicate about different issues.
Follow up if I may. Do you have a counterpart in Saratoga and Washington County?
Yep. And so once a month, the directors meet with the Workforce Development Board director, and we have regular meetings. We schedule them a year out. Yeah.
Great. Thank you.
Good. Mr. Leggett, did I see your hand up, or has the question been answered?
The allocation, how's it divided up? Everybody take a third, or? There's a formula that's generated, and part of it is based on, they often call it, word escapes me. When Congress authorizes the amount, they only authorize the total formula. It's a formula grant, and I can send you, there's like 19 pages of calculations that are used to determine how much money we get. And actually that is I wanted to bring this up later, but since you brought it up now, we actually have very good news starting July 1. The current year that we're in, and I had shared this with leadership, we had a budget deficit for our current program year that started July 1. We were able to handle it through some accounting, but even though the total funding for the country was level funded, our share is going up 20%. So we will not have that budget issue starting July 1 that we currently have. So that was the good news item. We just found that out late last week.
That was good to hear.
Yeah, it was great to hear.
Great. Supervisor Driscoll.
Thank you, Madam Chairman. I had the opportunity to attend their most recent meeting on the 10th of April at Chris's invitation, and I think in reference to Mr. Loeb's question, I think the collaboration that exists between all of the three counties, especially as far as employment goes. I mean, if there's a rash of jobs available in Saratoga Springs or in Hudson Falls, county residents from Warren certainly want to be able to access that information. So I think the collaboration actually probably saves us money and improves the number of individuals that are being served.
We need to vote on that. All those in favor?
Aye.
Opposed? Carried. Thank you.
Next, Mr. Supervisor Loeb had asked the question at the last meeting, and I'm paraphrasing, and I hope it's fairly accurate. What would happen if the Saratoga, Warren, Washington Workforce Development Board did not exist? So the next few slides begin to address some of that answer, both in a quantitative response, but also in a qualitative response, and I'll get into some of the details. We're required to meet certain performance measures, and so in thinking about that question, I figured that I would start there, just for a couple reasons. Number one, so that you know these are things that we have to meet, but also I think it is a good taking off point to talk about the work that we do and the impact that it has. There's basically three activities within our formula funding. There's programs for adults, there's programs for dislocated workers, and then there's programs for youth. And I think we tend to focus a lot of our discussion on youth, just because it requires more attention in terms of resolutions and budgets and such, but really most of our funding goes to adult and dislocated workers. The data that is included is from the program year completed June 30th. We do get quarterly updates throughout the course of the year. But anyway, the impact on adult programs, which would be your page 2, we're measured by the number of people that receive jobs 90 days after they exit the program. And there's a goal for us of 68%, and in that program year we achieved a rate of 74%. I also gave you the state average, which was 69.7.
Madam Chair?
Yes.
Percent of what?
Percent of customers.
So quantitatively, percent of the three customers? Or?
I have those numbers towards the end.
Okay.
Yeah. So,
okay.
And I didn't break the numbers out by the 3 programs, but I do have the numbers. There's a similar measure for dislocated workers. So again, we feel that if we didn't provide these services, that there would be a higher number of dislocated workers on unemployment. Our entered employment rate was 73%. The goal was 66%. The goal for dislocated workers is lower because they tend to be harder to place. By definition, dislocated workers are people who are laid off due to mass plant closing. Typically, they need a lot more in terms of training to train for a new job. The next slide is on youth. For youth, instead of being measured strictly by employment, we're also measured by education or training. For purposes of the Workforce Innovation Act, youth are those age 14 to 24. Our summer program youth ended 21, so we do have different variables there. But the placement rate that we achieved a year ago was 67.7%. We were a little under our goal of 72, and actually the state average was significantly higher at 81.8. For youth, I do have the specific numbers. There were 32 youth in that measure. So I know for a fact in Warren County, for example, we had several youth that took the task exam in June. They only passed 1 or 2 of the required 3 steps, and they then went and got their diplomas, their equivalency diplomas in December. So, 2 or 3 children would change that from being below the goal to above the goal. Then we're also measured on longer-term employment, and one of the fallouts from the Great Recession was the percentage of people that are in employment, and that rate is tracked monthly. And one of the things that has happened is that it really hasn't gone back up to where it used to be. So the percentage of adults right now that are of working age that are actually employed is only about 79%, whereas historically for men it was well into the 90s. So the longer-term employment has become a more important measure because of the trends nationally. And you see here that the state average is 69.9%, the goal was 67%, and our programs achieved results of 73% for adults and 72% for dislocated workers.
I think Supervisor Leggett has a question before you go on.
Thank you, Madam Chair. Chris, that's out of total population, you say, on the longer term? It's out of our customers.
Out of your customers?
Yeah.
Okay.
And actually, the very next slide tells you some of the numbers. I didn't give you the specific numbers for the program year 17, but for the last 8 years, we have averaged in Warren County alone slightly under 11,000 customers a year, and for the workforce area, 25,000 customers a year. So that gives you an idea of the scale. I mean, it's several thousand Warren County residents every year that are included in these measures.
So,
go ahead.
Then, would we assume then that we have almost 30% unemployment?
So the unemployment rate, people often talk about how it can be deceiving. If you're not working and you're not looking for work, you're not counted in the unemployment rate. If you're
working part-time, but you want to work full-time, you're considered employed. So that's where you get into a lot of the differentiation between the actual unemployment rate, labor participation rate, labor market participation rate. It was at one point in time during the recession where literally 1 out of 5 males who were of working age were not working. Think about that for a minute. 1 out of 5 men of working age were not working. It was actually higher for men.
Question from Mr. McGowan first. Do you?
Yeah, so what is percentage for our county?
The labor market participation rate? They don't break it down by county.
Well, I mean, overall, with the people that are looking, not looking, and everything else, do you have kind of an idea?
No, it's very, yeah, they don't...
I mean, I'm not going to put you on the spot.
No, I know, I realize you're not. A lot of the data, that by the time you get it for like a county, it's so old that it's not really that useful. But, you know, one of the things that has really happened since the recovery is that a lot of the people that we see in our office are those that are hard to employ. They may have been out of work for a long time, and now they're trying to re-enter the labor market. So because of that, it's really hard to get a good grip on what that number might be.
Like
I mean, we have the
Supervisor
state
Loeb?
numbers, but that's as far as they break it down.
Right. Thank you, Madam Chair.
Sure, go ahead.
Or, following up on Supervisor Leggett's question of on adults' long-term employment, 73% are employed through you folks.
No. Most of them...
If they walk through your door, they become part of your statistic, and
Right.
no matter how they end up getting employed by anybody else.
Yep.
they're
In
also-
fact,
they're
in
part
fact,
of that 73%.
in fact, the vast majority of them are employed by, private corporations, private businesses.
So then this is 25% of people that they just don't succeed in getting a job?
Well, at the time the measure is being made, they're not in a job. It doesn't mean that
Maybe they get a
they're
job.
in between
6 months
jobs.
later, a year later.
Yeah.
Okay, thank you.
You're welcome. Chris?
The next slide, in addition to providing services to job seekers, we also provide a variety of business services. And I just put a slide in there that summarizes them very briefly. We do job postings. Actually, a big part of what we do is provide job postings for businesses that have openings. Again, that's becoming a bigger part of what we do because there's so many unfilled jobs currently. We've been holding monthly job fairs for the last year and a half. We have anywhere from 10 to 12 businesses. There's a community room in our building on the second floor where we host job fairs every month. We get about 35 people generally, job seekers. We also do on-site recruitments. If you're looking to hire 50 or 100 people, you can come set up shop in our office and take walk-ins. For Finch Paper and actually they're the only ones right now for Finch Paper. If you want to go apply for a job at Finch, you come to our office. We have their applications, and they actually will direct you to come to our office to apply to work there. And then once a week, we give them a pile of applications, and we provide assistance to the job seeker while they're there. We provide similar services for the hospital. Their job applications are online. If somebody goes to apply for a job at the hospital and they have questions, they tell them to come visit us, and our staff will walk them through the application process.
Supervisor Loeb, I know you have a
Yes,
question,
do we
but
get
we're going to kind of have to move along because
Do we
we're...
get compensated for that?
No, that's part of what we do.
Well, no, hold on. We get private companies are saying, we're gonna tap the county's resources to fund our HR department.
It's part of what we do.
I would lodge a protest to that. That's not appropriate.
This is federal money.
Yeah.
Once again, I'll double down on that.
But we have to follow their guidelines.
So therefore, Associates of Glens Falls, the insurance company, could just say, all right, we're closing, go to Chris, he'll take care of our HR part, that section of it, as well as any other company in Glens, in Warren County. They could do that, right?
So a lot of the money that's used to fund the office, not necessarily, our portion, but the Department of Labor staff, comes from unemployment insurance. And so, businesses are paying into those funds that are then used by us to run these programs. That's a partial answer to your question.
Okay. Make a note of that, Don.
I just had one quick last slide that I wanted to mention because, because the comment about the 3 counties. One of the programs that has been very successful for us is the machine tool training program, and quite frankly, it really wouldn't make sense to do that as a single county. All 3 counties provide students to that program, and our numbers go up and down. Locally, this year we only had 1 person from Warren County, but last year we had 4. And it's a class of 12, so 4 is more than our percentage. The other 2 counties each had 3. So there are some things that we do in collaboration. Wouldn't be possible without that collaboration.
All right, Mr. McGowan, quickly, please.
Yes, I just want to say, Chris, I did read in the paper, I know we talked about this before with the dying of the trades. And seeing that Queensbury School has brought back practical electricity, hopefully the machine shop will open back up and and get these kids back into working with their hands. That's where I've become, my knowledge kind of was formed. And it was very encouraging to see that coming back. And the machine shop, like I said, these are the trades that we need to keep things rolling.
We emphasize those programs. And then just in terms of the quantitative discussion, I included a copy of our newsletter. Has some stories in there. If you have any questions, feel free to let me know.
I appreciate your answering his question. It was good. Thank you.
I think it's great for the committee to...
Just to have a better idea of what, I agree with that. Thank you very much.
Yeah, you're welcome. Thank you.
Have a good, super.
Thank
Right
you.
or wrong.
Chris?
Right or wrong.
I just want to say, I want to give thanks to Chris and his office for coming up to North Warren Central School for a job fair that we had several years ago. The town of Chester kicked off an economic development initiative through focus groups afterwards. They find that the connection between employers and employees was lacking, so Chris came up to join in with many other businesses. That was put on by the Chamber of Commerce and the YMCA. Thank you.
It was great.
Appreciate it.
Very good. All
Right or
right,
wrong.
Dee.
Focus.
We are running a little bit
Should always
behind, so.
What's most accessible for the unemployed and underemployed. So we can argue about whether or not they're getting a free service from the program. But
Well, if everybody's entitled to it, but only a couple people are tapping into it, that's kind of...
I mean, but you can't walk on the campus of Fitch Paper and ask to do a job application, so they'll throw you out. I mean, it's not, you can't walk into the building and do a job application set up that way.
So they're using the term.
I'm not sure we can...
Why are the Boston Scientific, or why are they BD on Bay Road?
Yeah, who else would it be? Our people.
A lot of people are doing it online anyway, so...
Gotta have one stop.
The staff are wonderful and spectacular.
It's a good valid question.
We always do.
Okay.
Never stop.
Money request. Somebody, I know Ed doesn't like to do this, but we can both.
I think on this one, when it's all the transportation.
Okay, Dee, we're all set.
Item number 1, the New York State Office for the Aging has requested that we amend our New York Connects Memorandum of Understanding with the Hamilton County Department of the Social Services to include the monetary reimbursement that we've been giving them all along. We typically reimburse their staff the salary and fringe for anybody that's associated with the New York Connects program up to $40,000.
Someone make that motion, Supervisor Sokol, seconded by Supervisor McGowan. Any discussion? Supervisor Lowe.
Thank you, Madam Chair. We have quite a number of resolutions here which are all basically the same. Is there any way we can consolidate?
Well, I was just going to say to Dee that what we're going to do, I think, like 2 through 20, because they're all from funding under CSE, but I think she should at least briefly tell us what each one is. We aren't going to vote on each individual one. We'll vote on them all at the end. Is that all right, Mr. Loeb, do you think?
I can read it, but if she wants to read it for us again, that's fine, too.
Well, item number 1 is separate from the rest of them.
Right, exactly. So, okay, so let's do 2, and let's maybe just kind of briefly go through, just so, I know we can all read, but by the same token, I really think we should be aware of what we're voting on. So if you want to quickly go through those, and then we'll vote on 2 through 20.
Okay.
Can't read, Bill.
So items 2 through...
Wait a minute, Dee, I'm sorry, I got off track. Yes, I need to have a motion to...
We have a motion.
All right, now we're going to vote on it. So all those in favor of number 1?
Aye.
Opposed? Carried. Thank you.
Okay. So 2 through 20, the first one is the contract we have with the Glens Falls Association for the Blind. They provide in-home contact and support, information and assistance, and senior recreation and education. The Glens Falls Hospital provides our personal emergency response system. The Greater Glens Falls Senior Center, they provide in-home support and contact, information and assistance, as well as senior recreation and education. The Legal Aid Society provides our legal assistance and education. The Town of Chester, Town of Hague, Town of Horicon, Town of Johnsburg, Lake George, Lake Luzerne, Lake Pleasant, Long Lake, Stony Creek, Thurman, and Warrensburg and Wells. They provide transportation services to our seniors, and this is transportation to the like the mall, not doctor's offices, pharmacies, grocery store, things like that. Then we have a contract with the Warren-Hamilton County's Action Committee for Economic Opportunity, which provides home maintenance and repairs. Hamilton County Public Nursing and Warren County Public Nursing, they provide health promotion and education services. And these are all contracts that we have, but unfortunately due to the one-time increase we did in January, it negated all of these ones, so I had to come back to committee with them.
All right, now would someone like to make the motion? 2 through 20 resolution. Supervisor McDevitt, seconded by Supervisor Loeb. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
And then the only item I had for you is just a reminder that we have our senior luncheon on Friday, June 7th at the Holiday Inn. This will be to recognize our Warren and Hamilton County Seniors of the Year. I sent an invitation to all of you previously, and then we will be recognizing them at the June 19th board meeting here, our Warren County Seniors of the Year.
Very good. Anyone have any questions for Dee? Anyone from the audience have any questions? All right, then, thank you very much.
Thank you.
Have a good day.
Thanks, Dee.
Okay, Chris, you guys have waited a long time. Good.
Yeah.
We've got a quick one today.
Yep.
Thank you.
Thank you. But yep, just thanks, Chris.
Okay.
It's not a book. It's a good month.
Yep, I got it.
We're all set, Chris.
Good morning, everyone.
Good morning.
We have a pretty quick agenda here today. Before I get started, I would like to introduce and welcome Amy McBurn. She's been formally appointed to the
director position at Countryside Adult Home, and her credentials have been approved by the Department of Health. So we congratulate her and welcome her aboard. She has been with the county working at Countryside for, correct me if I'm wrong, 27 or 28 years?
27.
27 years, so.
Wonderful, congratulations.
She'll be presenting the overtime report and census report after we present the DSS information on the agenda.
Okay.
The first item that I have, and the only item that I have, is a request resolution to appoint a new member to the Warren County Youth Board for 2019. Youth Board membership is comprised of 19 Warren County residents, which includes representation from each municipality, representatives of the Warren County Board of Supervisors, youth representation, and one member at large. The member that we're asking to be appointed is Donnie Winslow from the town of Warrensburg.
All right, someone like to make that motion? Supervisor Sokol, seconded by Supervisor McDevitt. All those in favor? Aye. Opposed? Carried. Thank you.
There are no pending items, and I have attached for everyone's reading pleasure at their leisure a report of activities and updates at DSS.
Oh, very good. Thank
you. With that, you're welcome. I'll let Julie take over.
For the budget for the first quarter of the year, we're pretty much on target in both expense and revenue. If you look at actual lines, March of 2019 does quite a bit higher, but that's because we have 3 payrolls in it, which greatly affect the outcome. So, but we're really on target for the first quarter of the year. And for overtime, we're still up. We've got a few caseworkers hopefully wrapping up core training.
Mm-hmm.
We've had a few caseworkers promoted, so they're also doing some training.
Any questions from the committee? All right, thank you, Julie.
I passed out, our census is 35.
Right.
Since I've been acting as director, I've admitted 6 people. And I have great plans for as far as how I want to go about getting more people to come to Countryside and stay long term. Our overtime is up, but we have also had 2 retirements, and we're down with those 2 retirements 4 positions. And we're a 24-hour facility, and the weather has not been very, very nice to us this year.
Right. Okay, good. We're kind of happy to have you on board, and we're looking forward to seeing what happens. We'd like to see that number at the home go up, because that's been our big thing for the past few years. So we're looking forward to a good job up there. Supervisor Loeb?
Thank you, Madam
question?
Chair. Amy, just to repeat, welcome aboard. If you've been there a long time, you know it's a good facility. You're part of a good department, the social services department. I want to say confidently, I speak for the board, if there's anything you need from us. We like that facility. You're doing a good job. We think social services is doing a good job in that regard. Anything you need from us, let us know, please.
Thank you very much.
Okay, again, thank you all. Any committee members have any other questions? All right, if not, I guess I'll entertain a motion to adjourn.
Thank you.
Supervisor Loeb, seconded by Supervisor McDevitt. All in favor?
Aye.
Aye. Opposed? Carried.
That was your daughter? No. I read the